mental functioning. Symptoms of hypothyroidism depend on just how deficient the client's thyroid is. What signs and symptoms might you expect in a client who has hypothyroidism? Clients will report extreme fatigue, dry skin, brittle nails, and hair loss. Intolerance to cold is a common symptom. In addition, they may have fluid retention and weight gain, even though they have a decreased appetite. Dyspnea, constipation, menstrual difficulties, low blood pressure, bradycardia, and elevated serum cholesterol levels are also likely. The medical treatment for hypothyroidism is a thyroid hormone replacement medication. The most commonly used drug is levothyroxine sodium, or Synthroid. Therapeutic nursing management techniques will also be important for promoting comfort and prevent complications in clients who have hypothyroidism. What would you do for these clients? Nursing interventions include maintaining a warm environment and suggesting that they alternate activity with rest. Encourage clients to increase fluid intake to 2,000 milliliters per day to prevent complications. Encourage a high-fiber diet for the same reason. Provide emotional support about changes in appearance. As for hyperthyroidism, you would also teach the importance of adhering to a lifelong medication regimen, as well as the signs of both thyroid overmedication and undermedication. Let's look more closely at hypothyroidism by working through this critical thinking exercise. A 46-year-old client visits an outpatient clinic with symptoms of fatigue, cold intolerance, dry scaly skin, hoarseness, weight gain, and fluid retention. Based on JM symptoms, the nurse practitioner obtains thyroid studies, which reveal an elevated TSH and decreased T3 and T4 levels. She prescribed Synthroid, 0.1 milligrams PO daily, and tells her to return to the clinic in 1 month. What is the significance of the client's laboratory findings? When serum T3 and T4 are below normal, the pituitary gland is stimulated to release TSH in an attempt to bring T3 and T4 back to normal. What should the client be taught about her condition and her prescribed medication? How and when to take the medication, the necessity for complying with medication regime, side effects of the medication, the need for follow-up care. Side effects of Synthroid are rare unless the dosage is too high. That would cause nervousness, fast or irregular heart rate, heat intolerance, excessive weight loss, and diarrhea. The drug should not be discontinued without the advice of the practitioner. A thyroidectomy might be indicated for hyperthyroidism that does not respond to medical treatment or for thyroid cancer. A total thyroidectomy is done when the thyroid gland is excised completely. A subtotal thyroidectomy is the excision of approximately 5/6 of the thyroid gland. Prior to surgery, it is important that the client be euthyroid, that is, with TSH, T3, and T4 within normal ranges, if possible, to reduce the risk of thyroid storm following surgery. What would be some of the signs and symptoms of hyperthyroidism that might indicate the need for thyroidectomy? Signs and symptoms would include increased appetite, weight loss, fatigue, insomnia, heat intolerance, goiter, and exophthalmos, which is eyeball protrusion. A thyroidectomy is also indicated for cancer of the thyroid gland. What would be some of the signs and symptoms of thyroid gland cancer? Signs and symptoms of thyroid cancer include a hard, painless nodule, an enlarged thyroid gland, hoarseness or dysphagia, signs of hyper or hypothyroidism, and displacement of the trachea. When caring for a postoperative thyroidectomy client, it is important to prioritize your nursing interventions. Here's an example of what I mean. Last night I emailed Jim, a student preparing for NCLEX. I told him that he would be taking care of a client today who was having a thyroidectomy, and I asked him to tell me at least 3 areas to assess and monitor in the immediate postoperative period. Here's his reply. I researched this last night when I was formulating my initial care plan. Watching for complications, such as respiratory obstruction and hemorrhage, will be very important. To do that, I'll have to take vital signs frequently. I should probably use a tympanic thermometer to take the client's temperature, since the surgery involved the throat. I should also monitor intake and output. Jim really did his homework. All I'd add would be the evaluating the client's voice for extreme weakness or hoarseness, which might indicate injury to the laryngeal nerve. Since he did so well on the essential monitoring and assessment, I figured he'd want to review some other important nursing activities. I asked him to tell me about what else he'll do for this postoperative client. He replied, I know that it will be crucial to prevent strain on the suture line, so I will position the client in semi-Fowlers with pillows to support his head and neck. I will also continue to monitor vital signs to assess for bleeding. He will probably be receiving supplemental oxygen, so I will make sure that the appropriate safety precautions are taken. He was on a roll, so I asked him to think of any equipment or emergency supplies that should be readily available for this client. Here's his response. Because of the possibility of swelling and obstruction of the airway, I should have an emergency crash cart and a tracheostomy set available for immediate use. Of course, the client will already have an intravenous line to use for analgesia as well as any emergency medications. I think Jim is very well prepared to care for this postoperative client. He will be able to assess this client and intervene at the first sign of complications. And speaking of complications, let's take a look at a major one, thyroid storm. Let's review the symptoms: chest pain, palpitations, shortness of breath, disorientation, fever, flushing, and sweating. Okay, let's move on to the adrenal glands. They are triangular shaped and rest atop each kidney. Each has 2 parts: the cortex or outer portion of the gland, which produces glucocorticoids such as cortisol, mineral corticoid such as aldosterone, and the adrenal sex hormones, and the medulla or inner portion